Hello everyone, and welcome back to Thera Talks with Dr. Shrestha. Today, we're diving into the fascinating world of pharmacovigilance. WHO Causality Assessment Criteria, a crucial tool used in determining a causal relationship between a drug and an adverse event. WHO developed these criteria to provide a standardized approach to causality assessment, ensuring consistency and comparability in drug safety evaluations worldwide. The key components of these criteria are 1. Temporal relationship, 2. Alternative explanations, 3. De-challenge and AMP, re-challenge, 4. Clinical and AMP, biological plausibility, 5. Presence of similar reactions. 1. Temporal relationship. First up, we have the temporal relationship. This involves analyzing the time sequence between the start of drug therapy and the onset of an adverse reaction. Essentially, we're looking at whether the adverse event occurred shortly after the drug was administered, which can provide valuable insights into the potential causal relationship. 2. Alternative explanations. It's essential to systematically assess whether other factors or conditions could reasonably explain the event, ensuring a more accurate evaluation. 3. De-challenge and re-challenge. De-challenge and re-challenge play a significant role in the assessment process. These steps provide critical evidence for determining causality. De-challenge involves withdrawing a suspected drug to see if the adverse effects diminish or improve, while re-challenge is reintroducing the drug to observe if the adverse effects recur. 4. Clinical and biological plausibility. This entails scrutinizing whether the known pharmacological properties of the drug align with the observed adverse reaction, both clinically and biologically. 5. Presence of similar reactions. Lastly, we have to consider the presence of similar reactions with the same drug. When multiple cases report similar adverse events associated with a specific drug, it strengthens the case for considering the drug as a likely cause of the adverse events. Now, let's explore how healthcare professionals apply these criteria in clinical practice to make informed decisions regarding patient care. Certain category. There's a high degree of certainty that the observed event was caused by the drug. This conclusion is based on substantial evidence, with alternative explanations rigorously rejected. For example, angioedema is a common side effect of angiotensin-converting enzyme, ACE, inhibitors. ACE inhibitors are commonly used to treat conditions like hypertension and heart failure. The example cites angioedema caused by ACE inhibitors as a well-documented and widely acknowledged side effect from clinical trials, post-marketing surveillance, and case reports. This implies that the link between ACE inhibitors and angioedema is not only supported by individual studies but also recognized and accepted by the medical community. The widespread acceptance strengthens the certainty of the causal relationship with high levels of confidence. Probable or likely category. There's a high likelihood of a causal link between starting a new medication and experiencing adverse events. Strong evidence supports this despite some uncertainty. For example, a severe skin rash after starting a new medication, improving upon discontinuation and recurring upon reintroduction, suggests a possible causal relationship. This observed pattern reinforces probable association. Despite strong evidence, uncertainty remains due to atypical presentation, comorbid conditions, or confounding variables. Possible category. This category suggests a plausible but inconclusive causal link between a drug and an adverse event. Additional investigation and monitoring are needed to gather more evidence. If a patient has gastrointestinal issues after starting a new medication, it may be labeled possible if a link to the drug is plausible, but other factors may contribute to gastrointestinal issues. However, the absence of conclusive evidence, such as a clear improvement after de-challenge or recurrence after re-challenge, keeps the classification in the possible category. Unlikely category. In the unlikely category, the available evidence points to a low likelihood of a causal link between the drug and the observed adverse effect. Dechallenge and rechallenge are vital. If a patient develops unexpected side effects from a medication, stopping it, dechallenge, can resolve symptoms, confirming the drug's role. Furthermore, if the joint pain does not return after reintroducing the drug, rechallenge. This strengthens the case against the drug being the cause of the joint pain. Conditional or unclassified category. The conditional, unclassified category is for cases lacking enough data to determine causality. Ongoing surveillance and research are vital for more evidence. Thank you for your patience. Be sure to stay tuned for more informative videos. Take care.